Why is Matthew in the hospital?
Because he has a bad infection in his leg.
But why does he have an infection?
Because he has a cut on his leg and it got infected.
But why does he have a cut on his leg?
Because he was playing in the junkyard next to his apartment building and there was some sharp, jagged steel there that he fell on.
But why was he playing in the junkyard?
Because his neighborhood is kind of run down. A lot of kids play there and there's no one to supervise them.
But why does he live in that neighborhood?
Because his parents can't afford a nicer place to live.
But why can't his parents afford a nicer place to live?
Because his dad is unemployed and his mom is sick.
But why is his dad unemployed?
Because he doesn't have much education and he can't find a job.
But why? Physical inactivity. 55%.
Of the population 12 years and older who are physically inactive have less than a secondary level of education.
Unhealthy weight. 55%.
Of the population ages 20 to 59 who are overweight have less than a secondary level of education.
Unhealthy diet. 64%.
The populations ages 12 and older who eat less than the recommended amount of fruits and vegetables have less than a secondary level of education.
About 50%
Of the Canadian population
does not.
have the post-secondary education.
So why is education important?
Fact.
People with higher education tend to be healthier than those with lower educational attainment.
Lower education levels are linked to greater health risk factors including
Smoking.
Physical inactivity.
Unhealthy weight,
And unhealthy diet.
fact.
good health-related habits such as eating sensibly, exercising, and not smoking are associated with good education.
Education is necessary for personal and social success.
An educated person is much more capable of climbing the socioeconomic ladder and have better access to societal and economic resources.
They hold a better understanding of the world and are more equipped to comprehend the societal factors that influence their own health.
Fact.
A strong correlation exists between education and other social determinants of health.
There is a direct link between education and income.
Education and employment security,
Education and working conditions.
Literacy is defined as
the ability to understand and employ information in daily activities at home, at work, and in the community.
education increases
Overall literacy and comprehension of how one can build on one's health through their own action.
They gain a higher skill set on how to adopt behaviors that may be beneficial or harmful to their health.
fact.
A staggering proportion of people from
Developed countries
have low literacy levels.
Poor literacy skills make it very hard
To learn new skills, understand nutrition messaging, and to make a behavior change. So what can we do? One should note that
Public policies shape how education influences affect the population's health.
Therefore, lack of education in itself
is not the main factor causing poor health.
If adequate income and necessary services such as childcare could be offered to all of society, the associated link between education and health would greatly decline.
Health literacy is defined as
the ability to access, understand, evaluate, and communicate information as a way to promote, maintain, and improve health in a variety of settings.
health literacy.
It requires knowledge in many different areas, including body, health behavior, and health systems.
Fact.
A staggering number of Canadians have low health literacy skills.
An exhaustive analysis
proved the complexities of adult education, finding that adult learning in Canada is heavily weighted towards those
who are already well educated
Families who have a lower level of education
cannot help their children with their homework.
There is a large connection between socioeconomic status and education.
Children that need help with homework
are often found in homes of lower socioeconomic status
that are not equipped to help them. The cycle continues. Fact.
There is a strong correlation between children having greater educational success when they have more educated parents.
So how do we bridge the gap that limits the health options of people with lower education levels?
Is closing the gap possible?
If there is a genuine desire and vision to change the imbalance of health inequity and give everyone equal opportunity to live a healthy life, then
The answer is yes.
Everyone should be given equal opportunity.
If systematic differences in health for groups of people are avoidable by reasonable action, their existence is, quite simply, unfair.